The word achalasia originated from the Greek word khalasis, meaning failure to relax. It is not a very common disease. The etiology remains uncertain but is postulated to be due to loss of the inhibitory ganglion cells in the myenteric plexus, possibly related to a virus-induced autoimmune effect. Histology of muscle specimens generally shows a reduction in the number of ganglion cells with a variable degree of chronic inflammation. During a normal swallow, the food bolus will trigger primary peristalsis in the esophagus by sequential activation of excitatory lower motor neurons. The mismatch in excitatory and inhibitory activity results in the absent peristalsis of esophagus. With time, the esophagus dilates and contractions disappear, so that the esophagus empties mainly by the hydrostatic pressure of its contents. This is nearly always incomplete, leaving residual food and fluid. The air-fluid level in the stomach evidenced on radiography taken in the erect position in normal individuals is frequently absent, as no bolus with its accompanying air passes through the lower esophageal sphincter. The esophagus becomes progressively more tortuous and dilated, megaesophagus. Persistent retention esophagitis due to fermentation of food residues may predispose to the increased incidence of carcinoma of the esophagus. In South America, chronic infection with the parasite Trypanosoma cruzi causes Chagas disease, and the destruction of the myenteric plexus has marked clinical similarities to achalasia. A rare genetic syndrome, Allgrove syndrome, is associated with familial adrenal insufficiency, alacrimia and achalasia. The disease is most commonly diagnosed between 30 and 60 years of age. It typically presents with dysphagia to both solid and liquid, regurgitation and heartburn. Although chest pain and odynophagia is also common in the early stages. Patients often present late and, having had relatively mild symptoms, remain untreated for many years. Patients may or may not have experienced weight loss. Frequently, patients will adjust their diet according to symptoms and can maintain their body weight after an initial drop. An Eckhart score was developed to assess the severity of symptoms and monitor treatment outcome. Aspiration-related respiratory symptoms and pneumonia can also occur when there is significant stasis of food residue in the dilated esophagus. The retained food substance can cause fermentation and therefore halitosis. Patients may report regurgitating food that they have ingested before,